Hey, good morning, everyone. Eric Hamadi here with Family First Life Medicare with another really cool training. AEP is literally right around the corner. So it starts October 15th and this morning is September 21st. So we literally have less than 3 weeks. If you want to get contracted, you still have plenty of time. Go to fflmed.com. Go to the red button at the top of the screen, click Get Contracted and fill out the form there, and our team will get with you and get you contracted. One of the big misconceptions that people have is that you have to have AHIP before you can get contracted. That is not true, okay? If you have a health license, and that's all you need is a health license, you can get contracted for Medicare Supplement. Which, depending on where you live, more people may want Medicare Advantage, other people may want Medicare Supplement, but Medicare Supplement will allow you to at least tackle, depending on where you live, the majority of the market, half the market or less than half of the market, depending on where you live. But Medicare Supplement is great because for those of you guys that don't know, it's just as simple to write as final expense. Underwriting is the same, very similar. And the process is the same. All the compliance is the same. If you can do it selling final expense, you can do it selling Medicare Supplement. And so if you've never touched it before, you're kind of nervous about it, but you'd like to get contracted and learn about it and try your hand at it. That's the easiest low impact way, is to take your health license, get contracted with Medicare Supplement. We've got a bunch of great carriers, some integrity exclusives, as well as some well-known names, I guess household names, if you want to call them that. And once you get contracted through fflmed.com, you'll also have access to, once you have a writing number with those new carriers, you'll also have access to all the Medicare tools, including CSG actuarial, which is what Adrienne's going to go over. Zach Egan sat down with Adrienne earlier and went over in depth how CSG actuarial works. And for those of you that are selling Medicare Supplement, this is going to be your new best friend. For those of you selling Medicare Advantage, you can use CSG actuarial, and you can also use Connexure. You can also use Sunfire. You can also use Integrity's own homegrown tool. All of those are located inside Medicare Center, which is what Adrienne's going to go through with Zach during this next training. So buckle in and get out a pen and some paper and take some notes, but you'll really enjoy how these tools work and having access to them when you sit down with your clients. So literally just yesterday, I was able to help one of my clients who needed final expense, were able to take care of their final expense, but they were also turning 65. They turned 65 2 months ago and still had not taken care of their Medicare. And it was just so cool to be able to walk them through the process of taking, getting oriented with Medicare, setting up their Part B, and then also, talking them through what their options were with the supplement or Advantage, whatever it was. But being able to be knowledgeable about that and speak to them, the credibility went way up, and also their comfort level, not only with me, but with the final expense that they had chosen to get. You could tell just solidified immediately. And so it's going to lead to a lot of great referrals and extra business that I would not have gotten had I not taken the time to understand how Medicare works and talk to my client about it. So anyway, stay tuned for this training. And then at the end, we'll have a quick wrap up.
Yeah. So okay. CSG, now that they're partners of ours, this feature is full access CSG. So they can quote all products. They can run heat maps. They can run rate comparisons. They can even get some supplies. This thing is a beast.
Could you show us that one?
Yeah, absolutely.
Okay. Awesome.
And this is also the one where you can do certain med stuff and dental enrollments.
Awesome.
They don't have all the carriers available yet, but they are working on adding more. And I don't know what all Anna went over, but whenever you're utilizing the Medicare Center, all three of these will open in their own tabs up at the top. So you can easily go back as needed. And then this CRM version won't, because that's the built-in integrated one. Okay. So like I said, the other three are where you can do your Medicare Advantage or PDP enrollment. You can still utilize the CSG to quote those products if you want to. There are certain agents who prefer the CSG PDP quoting because they show the before and after gap breakdown of the drugs. So again, this is just something that as you're using the platform, you'll find what you like best, and then you'll utilize that. But this is where you can quote your MA, PDP, Final Expense, Hospital Indemnity, Dental Vision, and Medicare Supplement. I'm not sure why it's out of order, but all of those products you can at least quote on here. You can do e-applications for certain Medicare Supplement and dental products. This is a newer feature that they're super proud of because a lot of times when you're selling a Medicare Supplement, you sell a dental with it. And then when you're running the quotes on CSG, you can add both of those products to the cart and enroll them in a med sup and dental at the same time. So it's a really, really awesome new feature that they're doing. You mentioned going through a Medicare Supplement quote. So we'll do that first. Through the Medicare Center platform, because you've registered like with your identity, like everything you do within your login will save. So if you have an existing, book of business, you want to import your clients in here, you can. And then you can just start typing their name and it'll import their zip code, their gender, their age, all the things. And then if you were even importing a prospecting list or anything like that, you can do that as well. But for this, do you have a specific zip code you want me to use, Zach, for the example, or?
Not necessarily, but if you want me to get one for you, I will.
Well, I'll just use mine.
Yes, absolutely.
The amazing hot springs are, so you'll do your zip code, and then once you do your zip code, this button down here will populate. But the only way this show advanced option will populate is if you put that zip code in first. A lot of agents will be like, I can't find it, but you have to put that zip code in first. Age, gender, all the things, effective date, household, and then this show advanced. This is where you can add those underwriting filters. So this is the tool that we use to make us sound really, really smart all the time. So when you call in and you're like, hey, I have this client, they're diabetic, they're on this medication, all these things, what carrier will take them? Well, you can input all those here. You can select the health condition, the medications, you can add all of that. And then when you hit get quote, it will show you the carriers that will accept them. But I'm just going to do a basic Medicare supplement quote. This will always pop up. These are the carriers that you can do the e-application on. So it's Ascendo, Aetna, Great Southern, Independence, Mutual of Omaha, United Healthcare. These are the carriers you can do those e-apps through CSG. But then it just automatically looks like this with all the carriers, sorts by price. If it is available to do the e-app, you can hit apply now. And then it goes through the fill the blanks, just like on an e-application, which most agents are familiar with. And then if you are wanting to add to cart and then go add the dental, that's what you would do. You would just click add to cart. And only those options will apply when it's available.
What about the ones without the e-app? Does it have like a redirect to the website to do the e-app, or?
It'll direct you to the portal.
Okay.
If you go visit carrier resources.
Okay, perfect.
And then other popular features that are used are the market analytics filter. A lot of agents like to see the rate increase history for the carriers. So you just hit market analytics. You can see that for all of them. If you need to apply the household discount, you can easily just add it there. Prices will adjust as needed. And then if you did want to go back and add the health conditions, you could do that as well. And that's mostly everything for the Medicare supplement. This will show all carriers. I'll point that out because it does have a lot of questions. A lot of agents' questions are like, I don't want to see all these carriers. I only want to see mine, but it's going to show all of them on this platform. Do you have any questions about the Medicare supplement part? It's pretty simple. CSG has it pretty well organized. If you ever want to export a quote, like if I hit the PDF button right now, it would give me all of these quotes in a PDF. So it's really, really user friendly.
Awesome.
Yes, it is awesome. I'm just going to kind of go over like all my favorite things. And if you ever want like an actual walkthrough of a certain process on CSG, if you go to csgactuarial.com and you go to their learning center, their videos are the best. I mean, and they break them down specifically by each process because there's a lot of videos. So if there was anything you wanted additional training on, like walking through the e-app or anything like that, importing clients, there's a whole library full of those. I'm going to go back to the dashboard, and a really, really, really amazing feature that I try and push agents to use on here is the Fill the Gaps tool. So whenever you sell a Medicare Advantage, we call the perfect pair MA hospital indemnity. You want to pair that hospital indemnity with a Medicare Advantage plan. And CSG provides this tool called Fill the Gaps to help you do that. And I'll show you how to do that. So you'll do Medicare Advantage version 2, the new one. They're going to be doing away with this old one soon. So you'll go to the new one. Again, if you had your clients already in here, you could pull up their information. So I'm going to do just a Medicare Advantage. You can do, PDP and things like that. You can put the prescription drugs and doctors in here, and it will save them on file for you. The only thing about CSG is you cannot do the MA or PDP enrollments. I'm going to say no drug costs for this example. Going to get a Medicare Advantage quote, and this is what they'll look like at a glance. And then you'll click View Plan Details. You have to select the Medicare Advantage plan and click View Plan Details to get the Fill the Gaps button to populate. So once you do that, you will click the Fill the Gaps, and you're confirming the information, and then it's going to populate the hospital indemnity plans that qualify for those demographics. You can select more than one. For this example, I'm only going to select one, but you can scroll down and you'll see the carrier name here, and that's how you know like which one you want to use. So I'm going to go with SureBridge, add to comparison, and then what it's going to do is it's going to put it side by side with the Medicare Advantage plan. So that way you can fill the gaps like perfectly. It gives a really great visual as to what your client is going to be responsible for out of pocket versus what they could pay a month to help with those out of pocket costs. So for this example, they're paying $0 for well care, and the base plan is like $3.49 for this SureBridge. So if they go inpatient hospital, it's $360 per day, days 1 through 5. So you'd ask your client, can you afford $360 a day for 5 days? Most of the time they would probably say no, and then you can go over here to the hospital confinement benefits, and you can pick the one that's going to best match their out-of-pocket costs. So I'm going to go 6 days, because theirs is 5 days, and I'll do $350. And so that makes it $30 a month. So they're paying $0 for the MA, and if they're hospitalized, they'll get $350 a day for this $30 a month. I'm not going to go through all of them, but I just want to show you it goes through every section of the plan. So outpatient, you can do skilled nursing, ambulance, copay. And as you add things, it's going to update your monthly. And then if you want to, You can print this as well. That way you can give them a copy of their MA and their hospital indemnity, so they have a nice visual of how it's all going to work if they're ever in those situations, or if you just want to have it, before, they get there kind of thing. You have those options as well. So that's the fill the gaps feature. And if you did just want to quote hospital indemnity on its own, you can. Final expense, I'm sure that's what you already use, most likely Zach, and then of course the dental vision. Now it also offers Market Pulse, Market Edge, the document locker. You can do the scope of appointment through here as well. And then this is where you would go to see a copy of your e-applications that you've submitted. So the last kind of feature I want to brag about on CSG is this Market Edge. And what this does is it will provide you heat maps of your area, and it'll show you like where the most people turning 65 are, how many are enrolled in MedSup versus the Medicare Advantage. I'll go ahead and just give you a quick example. This is where you would go to run a rate comparison as well. So if you're wanting to see how competitive a certain product is in a certain area, you would be able to. So I'm just going to pick Arkansas, run search, and you don't have to pick a state, you can do the whole US. So if you're selling in multiple states. And then this is what the map looks like. So there were 10 Medicare Advantage quotes ran on this platform, is what this means. And there were 214 MedSup quotes ran. The population over 65, the population turning 65, and this is just in this area that I'm hovering over. And then it's MedSup policyholder, Medicare Advantage enrollments. So you can hover over any area and it will tell you the demographics. So obviously this is a feature that's definitely going to help agents determine what areas they're working in, what people are more enrolling in more in that area, kind of stuff. And again, you can export all of this as well. It's very, very interactive platform. Do you have any questions for me, Zach, about CSG?
No, I think this is awesome.
Yeah, it definitely is. And it's my go-to. A lot of times when agents have questions for me about products, I go here a lot to, just run the quote and see what's available and things like that.
Yeah, that's awesome.
Yeah. Export things. It's I don't even know the word for CSG. I call it a beast. That's just what I call it.
I think they'd say it's a robust.
Yeah, robust. That's pretty great. I like beast, so.
Yeah, that is.
It does so much. But most of the time, agents use it just for their Medicare supplement quoting. They're trying really hard to push for the enrollment part as well. And I do have a few agents who have been utilizing it just for their dental enrollments, trying it out, and some of the MedSup enrollments. But that's really kind of what they're trying to push for, is agents to utilize it to do the enrollments as well through here. You go to csgactuarial.com and then you hover over Learning Center. You can do the quoting tool tutorials, and then there's like quick overview, the search and save prescriptions. I mean, it breaks it down by like each feature because it's a lot.
That's awesome.
And then, of course, if you wanted to do the e-app or the client manager, the scope, even the market data, kind of like the map I showed you, she'll show you how to do a rate comparison as well. I don't know how often agents use that feature. I know that a lot of them like this map to learn about their area. And then, of course, the e-app tutorials, they're all here. Yeah. And I'm happy to send you over this recording.
Awesome. Sounds good.
Do you feel confident?
Yeah, I'll have to give it a try a couple times and then I'll feel confident.
Okay. I know that you did you go over like the CRM or the Medicare link at all?
No, but the Medicare link, from what you said, I think that the only people that will be using that would be, like you said, the people who have already used it. So
Well, if you ever want, so if you go to Medicare Link, because I do get questions sometimes from agents about it, what I'll do is they have a location, this little thing, frequently asked question. This is how I answer their question. But if you go to like the quoting, like if you go to each of these, there's videos for each of these if you're curious how that platform works. There are some agents who absolutely love this platform. The only thing is it has less carriers as well. So that part's not fun because you can go to the Learning Center at any time and see the comparison chart.
Oh, that's awesome.
And it'll show you like Medicare Link doesn't have as many as Medicare app.
Okay.
Yeah.
Got it.
And then the ones with the stars are the ones that you can do those HRAs with. Because year before, agents didn't use Medicare Center that much because you couldn't get that extra $50 for the HRA. So they made that available now, but it's only with these certain carriers with the stars.
Got it.
Okay, I think that's all the really important things you need to know at a glance.
Got it.
Okay. So if you like that training, if that tool looked like it's something that you definitely want to use, in order to access it, again, all you need is a writing number as a new agent for one of our Medicare supplement carriers under elder care that we have. So that's Medico, Capital, MAC, USIC, Humana. Shoot, man, there's a bunch, there's like 9, but I forgot the list right now. But anyway, that's if it just, again, fflmed.com, get contracted, fill out the form, get one of those writing numbers set up, and then you'll have access to all those tools that Adrienne just went over with Zach. So for our next segment, we're going to have Ron Miller. He's going to have the folks from Attentive on. They were doing that. This is with the FFL supplemental that they're doing with Cigna. There's some really cool things for those of you that are focused on the B2B market or have clients that are in that business to business environment. Really, really great value proposition. So anyway, enjoy.
Hey everyone. So welcome to Family First Life Supplemental. I'm Ron Miller. So today we have part 2 with Attentive to pick up the pieces from where we were at last time. And today we have Mr. Shane Kirkland, who is on our last Zoom call. He's the Vice President of Broker Development for Attentive. And we have another special guest, which is Joel Scardelli. He's the Director of Member Engagement. So Joel's going to take us through what happens when we first meet the employer, from the intro of you going to the employer talking about Attentive. He's going to take us through the process that you're going to go through to the closing of the sale. So Joel, if you can walk us through that and what we need to do at this point.
You bet. Thanks, Ron. Appreciate it. Welcome, everybody. Thanks for being with us. So the process that we've mapped out, we've really come to customize, and a lot of it has to do with you guys at Family First Life. What we wanted to do is streamline a process that could be easily duplicated and really condensed. We want to be able to give you the ammunition to go in and present to a client, and regardless of the forum, be able to introduce the concept of Attentive and move the ball forward rather quickly and not require a lot of time or energy from the client standpoint. And so I'm going to share with you our broker partner new business playbook. And I just want to kind of highlight a few things in the process so that you understand, and we'll share this with the team so you have all this at your disposal, but so that you come to understand, what does the process look like and what do we need to do on your side so that you can get a client from great idea to close in a week. And we're seeing it happen. So here's how the process starts. As you're engaging with an employer or business leader, introducing the concept of Attentive is fairly simple. We're not looking for you to know how we do what we do, just know what we do. What we do is pretty straightforward. We deliver a financial impact to employers. We help to improve their bottom lines while also getting their employees healthier. And you can kind of leave it at that. There's no capital expense and there's no disruption. So the two biggest hurdles that people typically face, which are, I don't want to change anything and I don't want to pay for anything, are completely off the table. So don't worry about those two and feel comfortable saying that. No capital expense and no disruption. If a client is interested and they say, wow, that sounds intriguing, I'd like to know more, that's really the next step. And here we are in step 2. Are you available next Tuesday at 3? Schedule a Zoom meeting. The attentive team will join and support that meeting and deliver directly to the client. Be on the call to support us, be the executive sponsor, move things along, help to host and facilitate. But the reality is, we at Attentive will handle the lift on the presentation side. When we end that meeting, we should be ending that meeting with the client saying, wow, that's really, really powerful. Now what? How can I take advantage of this? Or how can I learn more so that I can take advantage of it? 2 perfectly legitimate questions. The answer is rather simple. All we need is a basic census. And when I say basic, I mean really basic. All we need is gross salaries and work state. With those 2 minimum pieces of information, we can generate a quote. We can get more, and I'll show you the census in a moment. So we can get more info if it's readily available. But with 2 simple pieces of information like that, we're also checking off our list a major hurdle, which is getting an HR benefits team or a payroll department to fork over a whole lot of information. You're asking for 2 pieces of information, gross salaries and work state. Once you have that information, send it to Attentive. We'll generate a quote. We'll work with you on the delivery of the quote, either through you or to the client directly, whichever you prefer. From there, we'll answer any questions, but the reality is the client's going to see a quote that's going to be very financially impactful. And that's where they decide to make a decision to move forward. They sign the master service agreement, and the sale process is over. From there, all of the heavy lift and the work falls on Attentive, and we handle it. That's where we are in post-sale. I'll just share with you the information we need again from a quote perspective. We can do what we do with a quote with as minimal information as work state and gross salaries. We can make assumptions around other things. And the final number that a client sees when we go live will only be bigger and better. It won't go down. We're making very conservative assumptions so we can get a quote turned around quickly, easily, without a lot of information needed. This is an example of the quote, just to show you kind of what it looks like. But we can turn this quote around in about 48 hours, depending on, our volume, first in, first out. But you get us the census. What we'll do is we'll work on getting the quote generated. As I said, this is about financial impact. This is about delivering to that business leader a solution that will change the financial landscape for their business without disrupting anything. No changing of benefit plans or carriers or networks or any of that. Everything stays the same. But the financial impact is straight away right in front of them and really easy to understand. We're happy to take a client through the quote if that's helpful, especially the first time or two. That probably would be preferred. But from there, if you feel comfortable taking them through this and answering high-level questions, feel free to do that on your own. The implementation process, once they decide to move forward and sign the master service agreement, that's the kickoff for the post-sale. Once they sign that MSA and you send it back to us, we will work with their payroll department, whether in-house or external, to get the PTA report as the post-tax allotment report generated. That is needed for 2 things. It's needed to set up payroll and to set up the enrollment so that you and your team, as you're going in there and meeting with individual employees and guiding them on what they can buy with their benefits budget, down to the penny exactly how much money they have every month to spend on additional benefits. So that's what that PTA report is for. From there, our risk attorneys will draft the documents for them and we'll set up the payroll, do a final mock payroll run, and go right into to enrollment, make sure everything's ready to go and go live. So that's the process at a glance, from start, introduction to a client, all the way through to the end when a client goes live. That process is very, very seamless. And as you can see, we handle the majority of what goes on because most of that is post-sale.
So this is very, very simple in my eyes, and just listening to you. So pretty much we set up the initial meeting with the employer to get them excited about what we're doing. At that point, we're going to set up a 30 to 60 minute Zoom meeting with yourself or with Shane, with the client. And at that point, move forward. Now, the last Zoom call that we talked, or Shane talked at, he mentioned the CIMRC, there's a piece of information that describes the tax savings, stuff like that. Is that something that they sign as well towards or after the meeting with yourself, or is it the very beginning, or what happens at that point?
So the only thing the client's signing is really the master service agreement, and that happens, Ron, after the client gets the quote, sees the financial impact, and makes a decision. Yeah, this is for us, and we'd like you to deploy this program for our company. So sign the master service agreement to move forward. The SMR, the Self-Insured Medical Reimbursement Plan document, is one of the 3 documents that we'll work with the client on drafting on their behalf, and those are the 3 documents that ensure that they're compliant. And so we'll work on drafting all of that. So that's not a workload from the client's perspective. That's on us, and we handle that post-sale. All of that happens. If I divert back to the implementation timeline, you can see that resides sort of right here on that 1, 2, 3, that third bubble there. That's where our ERISA attorneys are drafting those legal agreements, those legally binding, those plan documents that ensure they're compliant. But we do all that. That's not the client's job.
So this is pretty awesome. I mean, from start to finish, I mean, you guys are going to be there essentially like to hold our hands so we can finish this from start to finish. I mean, you guys are going to be there from the beginning to the end, which I love. And you're there to answer any questions. So again, I guess the hardest part on our side is getting them excited about the program. And with you guys, just so everybody knows, there's a lot of marketing material that's already been created to help simplify this process for you to talk to the owner of a business. And that's going to be sent out here shortly, I would say within the next 2 or 3 weeks. So there's going to be an ability for y'all to have marketing materials. So you can give it to them. There's there's a video that's going to be coming out as well. It's less than a minute for them to grab somebody's attention. So you're going to be able to send that out to your list of employers or owners that you may already know, or you may have their information. You just want to send it to them, period, with your own information that's going to be attached to this. But from start to finish, guys, this is a no-brainer. I mean, what employer do you know or owner of a company would not take advantage of having the tax savings that they're going to be able to implement for the year for these employees that are taking part in this, and then actually with the employees getting free supplemental coverage it's amazing for the fact that one of those policies, it could be a cancer policy or heart policy, it could be 10x, 20x, 100x what it's worth. As you know, guys, with cancer, someone gets diagnosed with cancer, that's something that could be long lasting for 2, 3, 4, 5 years. And having a cancer policy to help offset those expenses speaks very loudly. And it's just a blessing altogether. So now with the ability for us that we've partnered with Cigna, which is the largest health insurance provider in the United States, to offer this supplemental, these true living benefits is a blessing. But now with the ability to have Attentive also come in to partner with us so we can provide those services to larger groups is amazing. So I just want to say thank you to you, Shane, and to you, Joel, for bringing that to us here at Family First Life. And we are really looking forward to moving forward and getting more of our agents to be a part of this.
Our pleasure. Yeah, thank you.
Absolutely. So Shane, on your behalf, for what you're doing as a the Vice President of Broker Development, can you talk to us a little bit more about once the contracts are being sent out to our agents, what's the next step after that?
We're developing a welcome email for everyone. So they'll have an email generated to them. That'll have a couple of links to them. One of the links will be to the CRM or a link to all of the marketing material, some additional information. Then they'll have my personal contact information with my Zoom link or Calendly link so they can schedule Zoom meetings as well. So it will be a continuing, drip campaign of information to them. Joel and I will be working hand in hand with a lot of broker partners, your team, to reach out to them actively and say, hey, have you got anything going on? And when they have a case between a yes and a no, we'll be looking at it, reaching out to them, asking, how can we help you move this case forward? So we're working on more and more communication so that everybody is involved, that we're front and center, that they know we're here. And especially making sure that they know when their contracts are accepted and processed. So, and then just constant communication. And we're working on some additional information where we're doing some email and or text campaigns out to our broker partners, just to keep in touch with them. Anytime there's a new update, we'll send out some information saying, hey, this marketing material has just been updated. Make sure to click on the link that you already have. Anytime we add information, they'll have access to it. So really working on more forward communication to make sure that everybody knows that, hey, you're part of our team and we want to be in touch with you.
Awesome. Now, for Joel, is there a minimum requirement for tenant to come in and be or take place with these business owners? Is there like, do you have a minimum of 5 employees, 10 employees? How does this work?
Yeah, we don't have a minimum. I mean, we'll go down to one life. You're going to have minimum requirements on the benefit side. I'm sure that could prevent that from happening and being able to deploy a particular solution on the group side. But no, there's no minimum from a tenant standpoint in terms of the minimum number of lives.
And what is the typical turnaround from start to finish? If I went to an employer today, or but a business owner, and I said, hey, start talking about attentive, how fast can this move from, let's say I go in on a Monday, we set up a Zoom call with you on Tuesday. What is the process at that point? How long will it take for us to move forward?
So I'll tell you the sales side, and maybe lean on Shane a little bit on the back end once the account is made a decision to move forward. The sale can happen as quickly as a day. Obviously, you schedule a meeting with a determined client that wants to move forward and make a decision. We can present to them and make that decision, get them to MSA, get that to a post-sale process. From there, when they make the decision to move forward to the time that they're live, there are a lot of variables that go into it, none the least of which the enrollment process, getting the information from the payroll department. So I'll lean on Shane a little bit in terms of what he sees timing wise, but that's a pretty big variance in terms of the fastest client or the longest client. Shane.
Well, and we'll use the example we had the other day, Joel. We had a broker partner use Joel's playbook, the playbook that we had. He went from presentation to scheduled enrollment within 8 days. Our only variable is your enrollment. So we can't determine your enrollment process 3 days, 5 days, 12 days, depending on the size of the case. But if you get us the information by the 15th of the month, we can do it first of the following month effective. So it takes us less than 2 weeks to get everything done that we need done, from payroll call, setup call, welcome call to the client, enrollment results report, and then running a mock payroll and making sure there are no discrepancies. We can get everything handled, whether it's a 10 life case or 10,000 life case, in 15 days. Done. It can be a lot less than that, but we tell you by the 15th to give everything to us by the 15th for a first of the month effective. So 3-week process at the most. If you started something on the 1st and you finished the enrollment by the 15th, you've got the first of the month effective date locked in.
Perfect. And then for what are some of the benefits? We went over this last Zoom call, but what are in your mind, for you, Joel or Shane, what are some benefits that really just stand out that we as agents can use to attract those business owners?
Well, there's a lot of strategies. All right. So when you say benefits, I'm not sure if you're talking about the benefits of the program or actual benefits inside the plan, but
let's talk about the benefits inside the plan for those employees. Something that's going to be able to really have the business owners like open their ears and say, wait a minute, you're telling me what now? Right.
So several things. One, Joel being the director of member engagement, he's really good at helping employers and employees understand that we're proactive, that we are not a hope and a prayer strategy, that we actually have an engagement platform to help their employees be healthy, right? And I'll let Joel, if we need to, go into more detail on how the that process works, but through the art of engagement and science and everything, we know how to help employees get healthier that are already sick, whether it be diabetes or whatever. So we're going to help them, which is going to drive healthcare costs down for that employer. But the other thing that really is going to catch the employer's attention is we're going to reduce their claims, right? Instead of that employee getting hurt, going directly to the emergency room, having a high deductible, high claim, which is going to drive those rates up next year, they can use every program inside of our preventative care management plan with no deductible, no copay. Some employers already have an EAP, or they may already have a telemedicine program, but it's usually attached to their medical program or standalone, and they're either paying for it or there's a deductible included and it counts as a utilization against their medical coverage. Our program is, I don't like using the word free, but there's no cost involved to the employee or the employer to utilize the benefits inside of our plan, whether it be the couples counseling, whether it be the EAP, whether it be the telemedicine, the teledentistry, whether it be our relationship with the Mayo Clinic, just to mention a few of those. So the key thing is reduction in claims, reduction of cost, and no out-of-pocket expense for the employer or the employee. And that really does grab their attention, on top of, hey, there's a huge tax savings for everyone involved as well. Joel, if I missed anything, feel free to jump in.
I think you did great. That was excellent. Appreciate that. The only thing, Ron, the only thing I think I would add is just the things that I opened up with, which are the hurdles. Sometimes the biggest benefit can be addressing the biggest hurdle up front and eliminating it. We hear pushback from employers sometimes that I don't want to change something, so I'm going to pass this time. I don't want to pay anything, so I'm going to take a pass. There's no cost, there's no capital expense to the program, to the business, and there's no disruption. So we're not going to change anything they have in place, and it's not going to be a capital expense. Those two things alone open up eyes and ears a lot very quickly. It kind of disarms the prospective client or the client from feeling like you're going to just sell me something and I'm going to have to buy it, and I don't want to do that. This isn't about that. We're not selling you anything. This is an opportunity to increase revenue for your business, improve the health of your most valuable asset, which is your people, and reduce your healthcare expense all in one fell swoop at no capital expense and with no change. Is that interesting to you? Yeah, it's interesting. How about a 30 to 60 minute Zoom next Tuesday at 3? How does that sound? Right, and then move them towards that next step. So that's how we open up the door a lot. It's just kind of keep it simple, but talk about the things that you know that are probably going to be hindrances to getting the thing moving along. Change and money, get them off the table. There's a financial impact. There's an improvement impact to your workers. You want to hear more? Yeah, I'd hear more. Sure. Cool. Let's move forward.
Then again, the people that can participate in the attendant program with these business owners, these employers, they have to have health insurance with that employer. Am I correct?
Whether it's their current employer, their spouse's employer, or if they're under the age of 26, if it's on their parents' plan, it just cannot be something through the exchange that has a subsidy attached to it. And it's really just a check mark on our enrollment form. I certify that I have health insurance that meets the ACA code and is employer sponsored of some sort. It can be an ICRA, which is the individual coverage HRA. It can be a defined contribution plan. So there's a lot of different options, but they just have to have major medical of some sort as well.
And everybody that has it can participate, but the business owner himself cannot. Am I correct?
The reason a business owner cannot participate is if they are a sole proprietor, a partnership, or if they're a sub S corporation and they're more than a 2% shareholder. The IRS says they can't pre-tax, so that kind of locks them out of the post-tax allotment savings. If they're a true C Corp and they are a W-2, bona fide W-2 employee, they can participate and get the post-tax allotment. But what we do for those owners that are sub-S partnerships and sole proprietors is we include them in the attentive program to get all of the benefits of the preventative care management program, and we bear the cost of that for them since they've made it available for their employees.
Awesome. Well, again, it's a pleasure talking with you today, Shane, and with Joel. Real quick, Shane, if someone wants to get a hold of you, what is your contact information?
Email is shane@ahwus.com. And my cell number, I'm on the road a lot, working mobile a lot, is 417 area code 849-3169.
Awesome. And what about yourself, Joel?
So my email is joel@ahwus.com. My cell 610-333-5100. If you missed that and you have Shane's info, we'll get you to me straight away.
Well, again, thank you guys for getting on the Zoom today and really helping us to understand the attentive program even more so. Like I said, we are really excited to bring this to the agents to help and protect more families with these living benefits on the supplemental side. So thank you for that. Everyone, if you haven't signed up, please get a hold of myself. You can contact me, Ron, at fflsup.com. And you can also reach out to our admin, which is contracting@fflsup.com. But thank you again, guys, for being on the Zoom today. And we look forward to working with you guys and everyone else. We'll see you all next week for our next Zoom. Take care.
Thanks, Ron.
Thank you,
Thank you,
Ron.
everybody.
Thanks.